today with the CEO of the Tahlequah City Hospital, Brian Woodliff. And Brian, we're so glad to have you here.
Well, thanks for having me, Patty.
We're very glad to have you in Tahlequah. When I first met you in the fall of 2002, which seems like forever ago, but really wasn't that long ago, Tahlequah City Hospital was in a world of hurt, the way I like to put it. And we brought you here with the prospects of keeping our hometown people in our hospital and reviving it and making it a better place and one that we can be proud of. What was your goal when you came here?
Well, my goal was set by a great board of directors that former Mayor Jerry Cook had just put in place. And we really set out on a strategic plan to bring patients to Tahlequah City Hospital as the alternative instead of going out of town. We call that out-migration. And what we had to do is really earn the respect of our local patrons, our neighbors, to come back to town. And so we had to go out and get the best technology, better facilities, and great physicians so they'd stay.
Oh, absolutely. And I think the most outward sign, or the most visible sign of your accomplishments, is the look of the Tahlequah City Hospital. The building itself looks massive. And we just continue to keep adding more and more facilities, it seems like, to accommodate all that you're going to bring here. What are our goals right now?
Well, we had to start, first of all, with emergency services.
Absolutely.
It's unintended injuries are the #1 killer of those under the age of 45. So emergency care was really the place where people were getting their impression about us. So the first thing we did was redesign the emergency room. We went from a little 3-room emergency department to a 12-room private emergency room. And now we have board-certified ER residency-trained physicians to take care of you. A lot of people don't know this, but 4 of the 5 emergency room physicians were former St. Francis emergency room. Actually, the current director was the director of St. Francis, so we like to say that you don't need to go to St. Francis anymore, just come right down to Tahlequah City because we're here. So that was step one. Step 2 was really looking at what are the healthcare concerns in Northeast Oklahoma. The two biggest killers, leading causes of death over 45, are heart disease and cancer. So most of us know someone who's suffered from heart disease or cancer. And we needed to partner with really sharp physicians, just like we did in the ER, so that patients would choose to come to us. And our first collaboration was with Cardiovascular Surgical Services that brought 2 heart surgeons and 3 cardiologists to our community for the first time ever. And now we're performing over 150 open heart surgeries a year, right here in Little Tahlequah, and we're also able to provide the other complementary, the cath lab, which provides vascular surgery and diagnostics and interventions. We provide about 100 cases there a month now. So that was truly a way to care for the people here so they could stay in town. And then, of course, cancer, and there's many preventative cancer treatments and diagnostics, but cancer still begins to be one of the leading causes of death. And so we partnered with some great physicians. Oklahoma Oncology out of Tulsa has 8 physicians and 1 that's stationed here. The radiation oncology, Dr. Murphy from Muskogee, he's stationed here. So we partnered with them, and now we have a cancer center, fully functional, comprehensive cancer center right here in town, so people can stay.
That's just amazing to me that Tahlequah is now a mecca for, unfortunately, patients. But you're right about the emergency room. I've had, unfortunately, to experience that, and it was amazing, the differences from night and day. And the new cancer center, and then we also have the new women's wing.
You're right.
At the hospital.
You're right.
We just continue to grow and take care of all the needs of our people in the area, northeastern Oklahoma, and I'm sure you get people from even further than that.
Well, we like to say that our market, from a business standpoint, reaches all 14 counties that surround us. The Cherokee Nation looks at themselves as serving the 14 counties that surround us, and so we've kind of partnered with them in that thinking. So people do come all the way from the Bartlesville area to see us and all the way down to the McAllister area to see us, and we're really proud of that. But every day we have to do everything we can to make that experience of service better, because the reality is when you're coming to an institution like a hospital, you have some anxiety about that. We've done studies, and it says 95% of everybody who comes to see us is in pain. They really don't want to be there. And when people are in pain, they don't act normal. And so our employees are trained to really touch the patient's life and make a difference and have that service attitude. And the thing that holds us accountable for that is that we're neighbors with most of these people. And that's the difference between the institutional care that you can get in a bigger city and more of the neighborly care you can get in Tahlequah.
Well, and I find that you have done a phenomenal job in reaching out to our community, informing our community with literature, having of course, the Hearts of Gold Gala, and inviting everybody into the community and learning more about what the hospital has in mind to do. And the gala is coming up.
You're right.
Corner.
Thanks for mentioning
and,
that. I appreciate
oh my
that.
goodness, it's just the greatest event of the season in Tahlequah, in my opinion.
It's February 13th this year, and it's really validating when people show up and really donate their time and their talent to that event. Last year we raised over $90,000, and that money from the gala went towards scholarships for our students that live right here in Tahlequah that are pursuing healthcare jobs, which we think is a great career path. And it also provides us some help for the indigent. I mean, as you read the headlines every day, you see that healthcare reform is so necessary, and so we're able to help those folks as well.
Well, and what I have found too is in visiting with you, you're bringing physicians to our area that were actually hometown people, or at least from this area,
right.
So that when you go to the hospital, it's a friendly face, somebody that understands your community and where you come from. And I think that's wonderful.
One of the ways that we've been able to kind of realize that is there are so many people that go to Northeastern State University that want to go on and pursue a medical degree. And as we met with the folks from OSU Medical Center, the #2 admission to OSU Medical Center is those who go to NSU. So we partnered with OSU to begin a family practice residency. So now, when you get out of medical school, you can come back to Tahlequah and train at Tahlequah City Hospital to become a family practice resident. We're very fortunate. Doug Nolan, one of our own, is the medical director of that program. So now folks will be here for 3 years, and we think most of them are going to choose to practice here when they get out of their training. We were thinking the other day about how many people have gone through the Tahlequah public school systems that have come back to serve in the role of physician. And that was a statistic that we were really blown away by. We currently have 9 active staff members that have graduated from or attended Tahlequah Public Schools. We're really proud of that.
Well, I think that you have done a remarkable job turning us around and becoming a headliner for small communities in the medical profession, and we appreciate all that you've done and your staff and everything that you've done for us, and we're glad that you're here on our program today. Good to see you.
We love Tahlequah, and thanks Bank First for promoting Tahlequah the way you do. It helps us recruit great people in and get the service out to people that need it.
Keep up the good work.
Thanks.
We'll be right back.